I'm Ted Giovanis, and welcome to Driving Research. Today we have Dr. Elliot Fishman of Johns Hopkins. Welcome, Elliot, and please tell the listeners a little bit about yourself and your role at Johns Hopkins.
Right. So thanks for inviting me to be here. I've been at Hopkins for more than 40 years. I came here as a fellow in radiology, and I've worked my way up ever since then. My interest was always in CAT scanning, CT scanning, and imaging. We did a lot of the initial work with Pixar on 3D medical imaging, a lot of work with CT, and for the last 8 or 9 years, been very involved in looking at artificial intelligence and how it can help us take care of our patients.
Yeah, and that feeds into my first substantive question is that because there's a lot going on with the development of artificial intelligence or AI in the medical world, but what is the status of AI today from your perspective?
Yeah, I mean, it's kind of funny, but depending what time of day you ask the question, you probably get a different answer because it's the most fluid thing I've ever seen, and the changes are rapid. What's interesting is AI is affecting everything from detection of disease, to treatment of disease, to managing of disease, to discovery. I think what's very exciting for all of us, anyone on this call, we all live in a world where we want to live forever or as close to that as possible. But you look at drug discovery, which would take 10 years, is now being down to a year. They could do a lot of the testing of drugs with simulation with AI, so you don't need to spend 3 to 6 years and a couple $1 billion to do the testing. And to the stuff that we do, which is trying to be able to use AI to help us read the scans or eventually read the scans itself to be more accurate. There's an error rate, which we know about, between 5 and 10% routinely, but can you do better? And what's been shown is when you get AI programs that work really well, in any field, there's always experts. You're an expert driver, but there's always people who are exceptional, and then there's the average. What AI seems to be able to do is take average and make them exceptional. So for the patient, what could be better that no matter where you are in Baltimore or any place in the world, your doctor is exceptional?
Yeah, and I think you've answered most of one of the questions I was going to ask about the diagnosis and treatment of patients, but do you see AI helping us identify metastasis in distant locations?
Well, I think that, right now, for example, there are programs to look for pulmonary emboli. There's programs in breast imaging, which I know you're very interested in. On breast imaging right now, it's concluded that you should not get a breast study, a mammogram, without AI, because in Europe and in the US, multiple studies have shown that AI is 30% better than most radiologists. So it's really, both looking at the primary and, people are working more. We look at lungs. So one of the most common places to get metastasis is to the lungs. And AI is better than most radiologists in looking and detecting lung metastasis. So again, the accuracy increases. And for the patient, it's the same study. Everything we do is post-processing. So there's nominal radiation dose, there's minimal difference in cost, but the accuracy increases.
Yeah. So, and I guess from a time frame standpoint, how will this all evolve in better patient outcomes? Is it just accelerating the time from identification to treatment, or will there be other things?
Yeah, I mean, for example, we're doing work on pancreatic cancer, so let's just look at that for a moment. When most people present with pancreatic cancer, right now, there's no good drug, right? The only cure is surgery. But 85% of patients, when they present day one, they're not resectable. What's been shown is when you look at scans that are read as negative, even in retrospect, you can't see the tumor. One field of AI is called radiomics. There's been several articles we've written, people from Mayo Clinic have written, which shows that you could pick up the tumor literally 12 to 36 months before it presents.
Wow.
Now, if that holds true, those are patients, pancreatic cancer, we say that 5-year survival is 11% across the board. That's with the numbers. But if you pick up people at stage 1 or stage 2, the survival even today is close to 60%. So if we can pick up, with pancreatic cancer, if we pick up those early cancers that are under 2 centimeters, they're small, we could, even right now, we could change survival from 11 to 50 or 60%, which is exciting.
Yeah, that is very exciting. So basically, we have a multiple whammy of trying to basically identify it earlier and basically move to better treatments later on. So is there anything else you think I've missed over right now?
No, I think one of the big things, kind of just what you mentioned about treatment, there was, if you read a number of different companies, almost every big drug company, there was a $1.2 billion joint venture announced within the last 3 weeks between Eli Lilly and NVIDIA to be able to do drug discovery, because the ability to use AI to figure out what the best drugs potentially are is very exciting. And whether it's Lilly or it's Roche or it's Merck, every company, you can name every drug company, is now using AI as the first step. And they expect that to increase detection of viable, the correct drugs, and the turnaround time from years, dropping it by, 3/4. So I think every step of the process. So for the patient, for all of us, and all of us someday are patients or family members of patients, the ability for detecting disease early, for coming up with novel treatments, for delivering them, for monitoring patients. There's a lot of work going on with liquid biopsy, which is going to be AI based. There's a lot of work developing vaccines, potentially that are specific to you for your tumor, which has been something that's been worked on for 30 years, never really has been that successful, but looks very promising as well.
Yeah, well, it sounds, all this sounds very promising. And actually, thanks, Elliot, for your time that you're spending today. And thanks for everybody for listening and watching. And hopefully we'll see you soon.